The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. This morning, Brad and I are joining you from our administrative offices, and our very special guest is Joe Seeley, Medicare Enrollment Coordinator at our very own Medicine Center Pharmacies. Good morning, Joe.
Morning, Paul. Morning, Brad. Thanks for having me.
Okay, if you're becoming eligible for Medicare or are currently eligible for Medicare, you know that it is the time of year when you are bombarded with phone calls, letters, and all other forms of solicitation for different Medicare plans. It is the annual open enrollment period from October 15th to December 7th. One recent study shows that 9 out of 10 Medicare patients are not in the best plan suited for their needs. And it's not surprising because, frankly, what could be more confusing than selecting the best Medicare plan for you? If you find Medicare confusing or are concerned that you're not in the best Medicare plan, our show today is dedicated to you. We want to be there to help you, to be that 1 in 10 patients that found the best plan to meet their needs. Please join us today and learn about our Medicare plans during open enrollment.
So, Joe, again, welcome to the show. Please take a moment and introduce yourself to our audience.
I spent about 35 years with a national wholesaler, the largest in the United States. In the last 10 years of that was in operations. We built what became a 4,700 virtual store chain of independent pharmacies. And we started that with 250 stores and built to like that 4,700. My operation duties there was I developed staff training for the people in those 4,700 stores. Operational support programs, we track growth and other administrative duties. The biggest challenges there was, just competing or continually adapting to industry changes. I retired from there in 2016. Then I kind of started my second career here for you, Paul, here at Medicine Center Pharmacy, and again in operations. I faced some of those same challenges all over again. Things were continually changing. The only difference was here it was more hands-on, and I got to say it was much more rewarding. I got a chance to see if the things that I learned in the previous 35 years and taught to our member stores actually made a difference and were worthwhile. I also got involved in many different kind of new-to-me responsibilities. The 3 or 4 years here have been as rewarding as the previous 35. I got to be involved in so many different things. One of the most rewarding jobs I did was last year I sat down at a table in each of our stores and assisted about 350 of our senior customers in selecting the best Medicare plan for them based on their specific needs. I became part of that great customer service that our staff, our pharmacists, our technicians bring to the table every day.
So, Joe, you are our Medicare enrollment specialist.
I guess. I'm not really a Medicare enrollment specialist other than there really isn't such an animal. There could be a licensed insurance agent which can enroll people, but Medicare rules are very specific. All I can do is present the information to the patient is honestly and is inclusive of all the plans that are available to them. And there's at least 40 different plans depending on what zip code they're in, but there's at least 40 different plans available. I can't hide plans or misrepresent plans. I just present the facts, an estimate of out-of-pocket costs for each patient based on the current year, and instruct the patient on his or her choice. There are just so many terms, choices, that there's a step-by-step order of events. It can be very confusing for so many people. So at Medicine Center Pharmacy, we purchased access to a very sophisticated and all-inclusive software system that loads in all the Medicare Advantage plans or the Medicare D plans that are available according to zip code. It factors in each patient's specific prescription uses and their specific needs, and then kind of sorts those plans for the customer from best to worst, so from lowest cost to highest cost. I learned enough about the system to use it pretty well, and then last year I was lucky enough to, again, have that sit down with some of our customers.
So these appointments, to me, sound a little confusing. Maybe we should start with the beginning. Let's say I'm 64 and will soon be retiring and eligible for Medicare. What can I expect?
Well, for one thing, the year before your 65th birthday, you're going to get a lot of junk mail and 2 or 3 robocalls a day. I mean, it's overwhelming. And most of it's so misleading. I mean, every caller tells you they're from Medicare Help Desk, and they're going to walk you through enrollment. You know, they're not from Medicare Help Desk. They're from an insurance company that really just wants you to enroll in their company. You need to do this for yourself. You need to talk to someone you can trust that'll help you through this process, not a random caller on the phone. Medicare starts at age 65 for most people. It can start for earlier for others that may suffer from a specific disability or other special situation, but that's not the usual case. To qualify for Medicare, you have to be a U.S. citizen or a legal resident that has lived in the United States for 5 consecutive years. At your 65th birthday, you are then in what is called the initial enrollment period. If you're already receiving Social Security at 65, maybe you've got a disability, or maybe you just elected to take Social Security early, at 62 and a half, like most of us can take. This process is automatic. About 3 months before your 65th birthday, you're just going to receive a Medicare card in the mail. It's kind of an early happy birthday present from Social Security. But if you're not receiving Social Security, you need to initiate this process on your own. You can do it in 3 different ways. You can enroll 3 months before your birthday month. So if your birthday's in April, then January, February, March, 1, 2, 3 months before April, you can start enrollment. The initial enrollment period then goes for 3 months after your birthday. So that's April, that's May, June, and July. 1, 2, 3. That's 7 months of an enrollment period. The easiest enrollment is kind of done through the Social Security website. It's honestly, when I did it, it was a 5-minute process. I expected it to be so much harder. You can do it via telephone, or you can just go in person to the nearest Social Security office. The process from initiating enrollment to actually receiving that Medicare card in the mail is about 3 weeks.
So, does everybody have to enroll in Medicare at age 65?
I guess the answer is no to both questions. Yeah, it's a free country, so have to enrollment. That's subjective. If you don't enroll in the initial enrollment period, that 7-month window we talked about around your 65th birthday, when you do enroll, there are monetary penalties to pay. The monetary penalties are based on a percentage times every month you delayed the enrollment. So unless there are specific circumstances or special circumstances, penalties will be a percentage of that cost. Some of the special circumstances for not enrolling, though, are you might still be working and still be getting health care through your employer. Or you might be covered in a valid health care plan that you bought on the open market. If those 2 things are there, you don't need to apply for Medicare. I guess the important thing is that you have some sort of health coverage, and that's what delayed you from enrolling in a timely manner, during that enrollment period. If you don't enroll in the enrollment period, there are 2 other chances to enroll. Every year from January 1st to March 31st, there's what's called the general enrollment period. Remember, if you wait to enroll then versus the initial enrollment period, there's that monetary penalty you're going to have to pay. But then there's also what's called the special enrollment period. And you might qualify for this, like you said, like I said before, is if you had your own insurance, or if you were working and you had insurance through your employer and then you retired later, say at age 68, then you qualify for the special enrollment period and you can enroll then. There are some chronic health conditions that also apply for special enrollment period. That would be an early enrollment. Typically, there's no penalty for enrollment if you qualify for special enrollment period.
So I got a card now. I got a Medicare card. What's it cover?
Your card comes in the mail, like I said, within 3 weeks of applying. If there's some missing information, there may be a couple phone calls back and forth, but there should be little standing in the way of you getting this done. Your card comes with your 16-digit Medicare number and the date of enrolling in Medicare Part A and Medicare Part B. Medicare Part A will cover your hospital costs and any inpatient care that you get when you're in the hospital. Medicare Part B will cover just your doctor visits and any outpatient care that you've got. It covers at the rate of 80%, usually depending on what it's covering, and the rest is yours. And that's a big part of the Medicare Part C and Part D is a big part of what we do in the meetings that we hold in the stores with seniors when we sit down and explain all the options to them. But your Medicare card is strictly Part A and Part B.
Okay, so the next question is, do we have to consider Part C and D?
Yeah, you do have to consider Part C and D. There's for Part A and Part B, there is really no cost. I mean, there's no cost for Part A. If you or your spouse has worked and paid taxes to Medicare for more than 10 years, there's no fee for Medicare Part A, and that's you or your spouse. Part A, again, is that hospital part of Medicare, that inpatient part. If you didn't meet that 10-year requirement, there can be monthly fees assessed. Those fees are based on how much you did work and how much you did pay Medicare taxes. There's a standard fee for Part B. The doctor, the inpatient part of Medicare, the standard monthly fee in 2020 was about $144. Usually there's an increase from year to year on this. The standard fee in 2019 was $135, so there was a $9 increase. I don't know what the fee is next year. It hasn't been shared yet. If you have a high income, the fee actually can be higher. It can be based on your income.
Sure. Okay, first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't, our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for staff care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
This morning, Brad and I are joining you from our administrative offices, and our very special guest is Joe Seeley, Medicare Enrollment Coordinator at our very own Medicine Center Pharmacies. Good morning, Joe.
Morning, Paul. Morning, Brad.
This morning we're talking about Medicare.
We talked about Medicare A and B, and A, remember, is the health coverage of your hospital bills. B is your doctor's costs and outpatient costs. But there's so much more. And you mentioned Medicare C and D, and there are C and Ds. And Part A and B have you covered on those two things, but we didn't talk about prescription drugs. And prescription drugs are covered on Part D. And you know, prescription drugs can be very costly. If you do not have a Part D plan, literally you can be on drugs that cost you $2 a month, or you can be on drugs that cost you $1,000 a month. It depends on your health conditions. So how is that covered? That's covered by a Part D plan. But you also need a Part C plan. And the reason is to cover out-of-pocket costs. So after you received your Medicare card in the mail, that 3 weeks after you enrolled, you need to pick out a D plan that covers prescriptions and a C plan. Unlike A and B, which is one and done, C and D you have to enroll annually or re-enroll annually. If you don't, whatever you pick, whatever selection you pick, will just roll over. Depending on the C program that you pick, there might be limits on networks and accessibilities, but the limits result in cost control for both the patient and for the network. It kind of puts caps on the annual cost to the patient. The card holder's maximum out-of-pocket costs are capped in a specific dollar amount depending on what plan is chosen.
All right, so Joe, do you think everyone needs Medicare D coverage? And what if they don't take any prescriptions and want to wait till later?
Well, if they don't take any prescriptions and wait till later, you know those same penalties for missing the initial enrollment period? For every month you delay, there's a percentage added to what your premium is going to be. So you do need to enroll into a D, even if you don't actually take any active prescriptions at the time. I mean, things change.
What about all these crazy ads you see on TV, like Martin Sheen's card, Single Care, or the GoodRx card, and all these other cards? How do they factor into Medicare Part D coverage?
Well, Brett, you know that Single Care and GoodRx, those are not Part D cards. Those are cards that, frankly, you know a lot about them. Frankly, they screw around with they do not cover anything that gives you a cap on what your out-of-pocket spend is. They do not. All they really do is give you access to generic drugs at a lower cost. They may bypass what a copay is. For instance, I take a very cheap generic drug that literally the cost is about $3 a month, but my copay is $15. And all it does is give me legal access to paying a cash price on that versus the out-of-pocket cost. I think the C programs really are there just to cap that maximum out-of-pocket cost. We mentioned Part A and Part B. They pay 80%, usually an 80% of everything. Well, if you're getting a $1,000 bill for tonsillitis or for a broken arm in the emergency room, 20% is you're going to have to pay your $200. But if you're having a $150,000 heart operation or something like that, you're still paying a big chunk of that. You're still paying a percentage. There's no maximum out-of-pocket costs. So what a C program does is it limits what your maximum out-of-pocket costs are. And depending on which C program you're on, your out-of-pocket costs can be anywhere from $3,500 a year to $10,000 a year. It's kind of you select which one you want based on your own health needs.
Very interesting and very complicated, isn't it? I think we are at break time. Is that right, Brad?
Yep, time for the news.
You're listening to Health Matters with the Medicine Center Pharmacy, and it's time for the news.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing Medicare's open enrollment period with Joe Seeley.
All right, Joe, why should folks go through this enrollment period again year after year if they're happy with their current Medicare Part D or Advantage plan?
I mean, people should always review everything every year. And the reason is things change. The plan you picked out when you first went on Medicare may not quite suit you anymore. There was one study that showed by one of the newer members in this, a plan that just came out this year, but they did a study last year that showed that 9 out of 10 patients are on the wrong plan for them. So healthcare needs change. I mean, I ran marathons 5 years ago, and now I can run 3 miles. That's about it. You just kind of need to review that plan. And there are incentives for plans to get better. Plans are rated from 1-star to 5-star. You know, if you were on a 3-star plan that fell to 1-star, you know the service isn't very good anymore. You might be unhappy with the choices as far as what pharmacy you can go to or what drugs are covered and what drugs aren't covered. So you need to actually sit down and review this every year.
All right, so I know last year you sat down with about 350 patients at the Medicine Center and helped give them some information about different plans. Do you share things like star ratings with them? And what else do you learn when you get a Medicare review at the Medicine Center?
Well, we do share the star ratings with those, but we also share the current drugs that they're on, the drugs that they, for their specific health needs or their disease states, and we share what their expected out-of-pocket costs are going to be the following year for those plans. It's all about setting up expectations and determining what fits best for the patient. A lot of those patients were not on the correct plan, and they give a ton of reasons for not being on the correct plan. There's loyalty to a plan, loyalty to a specific insurance company. I did a review for a lady in New Philadelphia store last year. A different plan would have saved her $18 for the year. And in my mind, I'm thinking $18 is a ridiculous amount to go through the hassle of changing, even though it's like a phone call to change. Well, she jumped up and down, said $18, that's a free lunch for me. And, she said, sign me up, or how do I sign up? But I had other patients where I could show them over $1,000 savings by switching which plan they were on, and they resist it. People resist that, change. Everybody resists change. So sad to say that's kind of where we are. But we can show them the different plans. We can show them the networks, if their physician is preferred or not preferred, if our pharmacies are preferred or not preferred, and what drugs are covered.
Just to speak to maybe the anxiety of changing insurance plans, correct me if I'm wrong, Joe, but in theory, even though there's possibly 40 Medicare plans in the state of Ohio that a patient can choose from depending on their needs, they all are subject to the same Medicare guidelines and in theory should have similar services. They just might have slightly different copays and deductibles and gap periods. Is that a fair assessment?
That is a fair assessment. And a lot of it depends on the specific prescriptions they're on. For instance, Eliquis is one of the most popular prescriptions right now. It's a blood thinner for the heart. It's for people who have AFib. It's a very expensive medication. About half of the Medicare C plans agree that it's a popular drug and should be covered, and about half of them don't. And I mean, if they don't, it affects your deductible, and you're going to go into your pharmacy on January 1st, get your first fill in that pharmacy, and some of the ones I've looked at already, it opened yesterday. We looked at a couple of patients yesterday. It's a $1,000 bill for their first fill in January, depending on the drugs they're on. There was a diabetic patient we looked at yesterday in our Minerva store. Her first bill was $954 for the diabetic thing. Or we could put her in a different plan, and the first bill was, I think, $320, and that included deductibles. So it's very specific plans choose very specific drugs to cover and not cover.
So when you sit down with the patient, okay, you do look at the prescriptions they're taking, and of course the assumption is that this late in the year, that January 1st next year, you're going to be on the same medication. So that's how you analyze the proper program for an individual. Is that about right?
That is correct. There were a couple of cases last year that patients sat down, and they sat down in the chair, and the first thing they told me was one had just been diagnosed with stage 4 lung cancer. And we looked at several cancer drugs and added those fictitiously to her this year's profile to see what it would cover the next year. Another one sat down and said she had been diagnosed as diabetic. And so we added fictitiously some popular diabetic medications to her profile, and reviewed and did a assessment based on those fictitious additions to her medical profile, just because they knew that they had that health condition and that change coming for the following year. So, but mostly we sit down and we review their specific needs now. We have their drugs loaded in. If they're at Medicine Center Pharmacy, we already know their profiles, their medication profiles. We load that all in. And then the other thing we look at is, do they want to pay a monthly premium? And, it's kind of, if you pay a monthly premium, your copays are going to be a little bit lower. If you don't pay a monthly premium, your copays are going to be a little bit higher. So how do you want to proceed with this? We also look at patients there are several patients we have that winter in Florida for 3 months out of the year, or in the South for 3 months out of the year. Well, it would be silly to pick a local plan, one of the several regional plans that we have. They need a national plan because they're going to be 3 months out of the year. They're going to be accessing out-of-network doctors and physicians or whatever, hospitals. So they need to have something that's national versus regional. So we look at all that, and it's really tailored to what is comfortable for the patient.
So now, looking at all of these plans, basically what they're going to pay on a drug? Is that what you're saying?
We do. The software system we use taps into our pharmacy systems, and our prices are pretty much set. Granted that a drug does not go up in cost. And of course, there are cost changes throughout the year. But based on current costs that are in the system, we know what the insurance company is already dictated, what the price is going to be. I mean, you walk into one of our stores, you get a price, a copay, and a price. Well, that's not from us. That's dictated by whatever card you have. We run your card through the through the insurance company. The insurance comes back with what the copay is and what the price is. So when we sit down with a customer, we share with them what has already been submitted to CMS by the specific insurance companies and third parties, what their copays or what their costs will be for the next year, based on today's market, based on today's prices.
Can the insurance company change the price?
They can.
Without a price increase, okay?
They can, without a price increase from year to year, no, they cannot. But some of the things I've seen already, the prices have gone up, the copays have gone up, just from the few plans that we've done already. Copays are going from $5 to $7.50 or $5 to $10, and virtually most of the plans that we've looked at, virtually all of them have some sort of a price increase.
All right. Can they drop the drug out of their plan? From January 1st on, okay?
Not from January 1st on.
Okay.
Well, of course, drugs can drop out if they're not manufactured anymore or they're recalled. But yes, they can drop a drug out of it.
So, does this happen very often?
No, it does not.
Okay. I can't see people signing up for an insurance plan and they roll into January 1st. Oh, my drug's not covered anymore.
Well, each of the third parties by this time have already submitted to CMS what drugs are going to be covered under their plan. It's all written in stone already, and it's all been approved by CMS, by Medicare.
And one of the things we haven't talked about yet is that if you have a medication on your plan that has a higher copay than you're comfortable with paying, it offers an opportunity to have a discussion with one of our pharmacists so that maybe we can help you find a medication that will take care of your particular situation at a more efficient cost and save you some money. So these plan reviews also give you the opportunity to talk to one of our pharmacists and be able to say, look, this Eliquis that Joe mentioned is going to be $300 a month, and oh my gosh, I can't afford that. What can I do and still maintain my health? So we can have discussions like that.
And we did that many times last year, and it's why it was nice to do the reviews in each of the stores, because if I had a question, I'm not a pharmacist, I can't go through that with the customer, but I can certainly walk over to the pharmacist or they can walk over to our table and review that and look at the drugs that are not covered and make suggestions for what would be covered. Yes, you're right, Brad. The software system we use is very intuitive and allows us that choice.
Well, I think we should take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. This morning, Brad and I are joining you from our administrative offices, and our very special guest is Joe Seeley, Medicare Enrollment Coordinator at our very own Medicine Center Pharmacies. Good morning, Joe.
Morning, Paul. Morning, Brad.
Thanks for joining us. Let's get back to the last segment of the show. Okay, Joe, how many people changed last year?
Well, we didn't keep track of how many changed. Again, I'm not allowed to change for them unless I was their legal guardian or representative. I'm not a licensed insurance agent. I did sit there and watch probably 5 or 6 change right there. I gave them control of the keyboard. They changed their insurance plan right in front of me. Several others said they were going to go home. One of the nice things about our software system is that any patient that comes in and talks to us gives them the exact same access that I have to their information, and they can go home and they can log in, or they can have a trusted son, daughter, a responsible person log in and see the exact same information at their house, and they can change from there. We have very loyal customers. We had a lot of customers that changed because, our pharmacy was not a preferred pharmacy or network anymore, so they changed to a different plan that wasn't that did include Medicine Center as a pharmacy as a preferred network. And unfortunately, we had a lot of people who just resist change, and even though we showed them $1,000 or $2,000 savings over the year, they still walked away saying they were going to stay with who they were with. And I can't force them to change. It's their decision. So I'm not sure, Paul, to answer your question, half maybe. I know that only about, I think we mentioned before, 9 out of 10 are on the wrong plan. I know that's probably consistent with what I saw, and many of them should have changed.
Interesting. Loyalty is a funny thing, I guess, and particularly in healthcare. I don't want to lose my doctor. I want to keep my doctor, all that kind of stuff, and I want to stay with the insurance company I've been with for 40 years. So, very interesting.
Well,
I
applaud the lady that changed for $18. I mean, that.
Yeah.
In the end, it's just she kept her same doctor, she kept the same hospital, or that she's always been a part of. In the end, she's just writing a different check to a different insurance company, a lower price check. So
very interesting.
Okay, Joe. So last year you sat in each of our stores and conducted these patient interviews. Do you have a schedule yet for when you'll be available to meet with patients to do a free consultation?
I do. Next week, the week of October 26th, next week is the 19th. Next week I will be in Louisville, our Louisville store. I'll be in there Monday through Friday, half days. A couple of days I'll be early, a couple of days late for those that can't get there before 5. The following week, the week of the 26th, I will be in our Minerva store, again, all 5 days. November 2nd, that week, I will be in our Canton store. And November 9th, I'll be in our New Philadelphia store. And then the week before Thanksgiving, I'll be back in the Louisville store. That kind of takes us into Thanksgiving week, which I'm going to take off, to be honest.
Oh, come on. So the last day for enrollment is?
December 7th.
Okay.
How much time does it take to do a review of a patient's medication file?
Good question, Brad. A lot or none. Some of the interviews last year were done in 5 minutes, and it was obvious they were on the correct plan. We reviewed, printed out the analysis for the customers so they knew what their monthly bill or their copays were going to be each month of the year next year, or the following, this year, I guess it was. Some of them took 20 minutes to a half an hour. We did schedule, I think, at 20-minute or 30-minute intervals in the store. And if you call the store, you can get scheduled into a time slot. If it's done in 5 minutes, great. If it's not, we'll take as much time as you need to make sure that a customer leaves there knowing everything they need to know to make that decision.
Is there anything the patient should bring to that particular meeting or interview?
Yes. Their insurance card for this year, it helps quite a bit to see what they're on. When we look at it in our pharmacy system, we can't see the exact plan they're on. We see what's called BIN numbers. And a BIN number can cover as much as 15 different plans. So if I know what card they're on, which has their group number and their Medicaid number, not their Medicare number, but it's an identifier for which exact plan they're on. I can plug that into the system, and it makes it a good comparison. If they're not a Medicare pharmacy customer, they need to bring their prescription list, and I can plug those in. But if they are our customer, we already have that.
Well, I just want to let everybody know that you're welcome to schedule a free consultation with Joe or one of our pharmacists. Just give the pharmacy a call at the Canton, Louisville, Minerva, or New Philadelphia stores. You can find our phone numbers on our Facebook pages. You can find them on our website at medshoprx.com. That's MEDSHOPRX.com. And, Joe, we got about 30 seconds before we got to close. Do you have any parting wisdom for patients seeking Medicare plans?
No, other than sit down and really study it. Make a nice decision, an informed decision. It'll save you some money. I just want to restate kind of how rewarding this was for me personally to be able to sit in the stores and meet so many of our customers last year. And I'm looking forward to it again this year.
Why do we have so many differences in insurance plans? We ran out of time. I know we ran out of time. Okay, all right. Thanks a lot, Joe, for coming by today. Medicare Enrollment Coordinator. A special thank you to our sponsors, Studio Arts and Glass, Mercy Medical Center, and our technical producer, J.D. DeAngelis. As always, thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here next Friday at 9:10 a.m. on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.